Hi, I'm Baran. I am a certified diabetes care and education specialist at the Pediatric Specialty Clinic at Logan Health. Type 1 diabetes is an autoimmune disease where the pancreas is no longer making insulin. What happens is the immune system actually attacks those beta cells, so it recognizes a part of our own body as though it doesn't belong anymore, and that's why it's called an autoimmune disease. Type 2 diabetes is when the pancreas is making insulin still, but the body doesn't utilize it very well. It's called insulin resistance. Type 1 diabetes is fairly prevalent in the United States. About 1.6 million people have type 1 diabetes. That's according to the CDCES national statistics as of 2020. The interesting thing about this is that about 1.25 million people had type 1 diabetes in 2017. So that means that there's actually a 30% increase or rise in type 1 diabetes in the last 7 years. Of that 1.6 million, about 200,000 are children with type 1 diabetes. Probably the most common symptoms that we see initially are increased thirst and urination. So when the body isn't able to produce insulin, that makes the glucose values rise in the bloodstream. The body has to find a way to get rid of that excess sugar. So what it does is it actually flushes it through the kidneys. And during that process, it also pulls a lot of water. So people are going to the restroom quite frequently, as well as being really thirsty. There are some other symptoms, though, to be aware of with type 1 diabetes. We might see an increase in fatigue that's pretty extreme. Our body cells are not able to use their preferred fuel source, which is glucose. And so that means we're not getting the fuel that we need to really give those cells the energy to feel well. The other thing that we might see is blurred vision. So when our glucose levels are high, the lens in our eye will actually expand. This is transient though, so this will go away as the blood sugars come back down. They will actually go back to normal and our vision will return to what we expect. Some other things that we might see is really extreme hunger with weight loss. So sometimes we can actually see children lose up to 20% of their body weight before being diagnosed, and that's a pretty big loss of weight for children. There's some pretty exciting tools to manage diabetes, and we've had some really exciting things actually happen in the last couple of years. So there's two tools that I want to talk about today. The first one is a continuous glucose monitor, and this is a way for us to monitor the glucose values. It's actually a small device that gets placed underneath the skin, and this is something that can actually be placed at home. And the families just change this out every 1 to 2 weeks. And this device will actually read the glucose values and beam it to a device like a cell phone or a receiver. And this allows them to see their glucose values every 5 minutes throughout the day. This tells them their trends, where they're headed, and will even alert them when their blood sugars are too high or too low. The other device is an insulin pump. So this is a way for the patients to be able to get the insulin that they need without giving injections. And this device has changed. It's been around for quite a while, since the 1980s, but has changed dramatically in the last few years because we've now integrated it with continuous glucose monitors. And so what these devices are able to do is actually beam the glucose value over the pump, and the pump's taking that information and automatically adjusting insulin to try and keep those blood sugars in the normal range as much as possible. And this is really helping families to be able to take that daily burden of managing diabetes kind of off their shoulders and making it a little bit easier to keep blood sugars where they need to be. So you can call our clinic. Our number is 406-758-7490, or you can also go to our website, which is logan.org/diabetes. pediatric.gov/children's.